share recording, and I'm going to share to LinkedIn at this time. Are you ready?
I am ready.
No, wait, maybe it doesn't. Let me see. I cannot tell if you're live. I don't see it on my LinkedIn. Yeah.
So on my left upper corner, it shows live.
I know it shows live on me too, but I don't see it in the LinkedIn. So I don't know if people can see it.
Okay.
Yeah, I'm not sure if it's going live or not. It says live. Oh, it says record only. Okay, edit. All right, here. I got it figured out. All right, it's
Good.
Let me title this. What should I call this? Alzheimer's Q&A?
Yeah, that sounds good.
Dr. Bhatt, right? Is that the right way to pronounce it? Bhatt?
Bhatt, yep, yes.
Okay. Okay. Okay, I'm saying join us as we discuss implications of this disease on patient outcomes. Does that sound okay?
Yes, that sounds good.
Okay. All right, ready? 1, 2, 3. Okay. Hello, thank you, Dr. Kinal Bhatt, for joining us today. I am interviewing you on behalf of Leaders in Clinical Research. We are a group that supports women in STEM, and I appreciate your time today. If you could, please give us a brief introduction of yourself and include your background.
Well, thank you so much, Tia. I really appreciate this opportunity. So again, I am Dr. Kinal Bhatt. I am a regional medical director at Life Molecular Imaging. I am an MD MPH with about 8+ years of clinical research experience in various therapeutic areas. And I have now been with Life Molecular Imaging for about 1 year. So here at LMI, where we strive to develop novel PET tracers that improve early detection and characterization of chronic and life-threatening diseases, leading to better therapeutic outcomes and improved quality of life. So thank you again for giving me this platform.
Oh, yes, thank you for your time today. As we were talking before we started, I know you have some personal experience with Alzheimer's. Would you mind sharing that experience with our audience?
Sure, absolutely. So I think, Tia, you and I had this conversation before. My paternal grandmother and all of her siblings, I've seen them go through this very gruesome journey of memory loss. Now, back in their times, we're talking 20, 30 years ago, there were no particular diagnosis made. So to this date, we're assuming it was Alzheimer's disease. But that journey, not just her as a patient, but also the caregivers, which majority of the time included my mother or some of the other women in the family, and for them to have to give up their educational life, their careers, give up their time from their children, so that they can take care of this one individual who really needed care. So when I was asked to serve this particular therapeutic area, I just felt like it was my time to give back. So it's very personal.
Yeah, it's wonderful. Yeah, to have such a connection to the disease. I think many people can relate to having a caretaker role in Alzheimer's or dementia.
Absolutely.
So you work at LMI, which stands for Life Molecular Imaging. Could you explain what therapeutic areas they focus on?
Great question. So currently, I would say our main focus is on neurology, particularly Alzheimer's disease and other amyloid and tau protein related pathologies. Again, both amyloid and tau being key hallmark in diagnosis of Alzheimer's disease. At LMI, we are in unique position to have FDA-approved amyloid tracer called Neuraseq, and we also have our PI 2620 tau tracer that is in phase 2, and we soon plan to launch a phase 3 trial. We also have an extensive pipeline where we have both deuterated deprenol and alpha-synuclein in preclinical phases. Those are for neuroinflammation and movement disorder pathologies. We also have GP1, that's in our phase 2 for thromboembolism. And then we also have gallium and lutetium in phase 2 for prostate and breast cancer. And we also have FSPG for lung cancer, hepatocellular carcinoma, and inflammatory bowel disease. So I know it's a long list. I'm glad we are mostly just focusing on amyloid and tau and Alzheimer's disease today.
Yeah, it's a very long list. Thank you for sharing that with us. And when we're discussing Alzheimer's, could you please help me understand how it impacts the brain? I think we see the patients, but what's it actually doing to the brain?
Sure. So easy way to explain this so that our audiences who may not have the similar background can understand. There are tens of billions of neurons in the human brain to process and transmit information, whether it be via electrical or chemical signals. So typically what people most commonly associate Alzheimer's disease with is it's a shrinkage of brain, or what we know as brain atrophy. However, the brain typically shrinks to some degree even in healthy aging, but surprisingly does not lose those neurons in large numbers. In Alzheimer's disease, however, so damage is widespread. As many neurons stop functioning, you lose connections with other neurons and those neurons die. So Alzheimer's disrupts the processes vital to those neurons and their networks. That includes the communication, metabolism, and repair of the neurons.
Okay. And how does that damage cause complications in the Alzheimer's patient?
That's a great follow-up question. So Alzheimer's disease affects, as we know, cognitive function over time. It is a progressive disease, and individual. There are several stages of Alzheimer's disease. So without actually showing you a picture, I'll try as best as I can to verbally explain to you what we mean when we say Alzheimer's disease. So individuals in the preclinical disease phase, they're unlikely to be aware of these changes that are occurring with them, where cognitive function is not yet affected, but it can progress to something what we know as MCI, or mild cognitive impairment, or dementia. So MCI, that's due to Alzheimer's disease phase. Patients may have very mild symptoms that do not affect with everyday activities. And then you also have dementia due to Alzheimer's disease phase, which is further broken down to stages of mild, moderate, and severe, which reflects to degree to which symptoms interfere one's ability to carry out those everyday activities. there are various issues that can cause symptoms similar to those seen in Alzheimer's disease from memory loss. That can be anything from trouble with words and speaking and writing, confusion about time and space, changes in mood or personality, etc. So these are the things that usually patient, perhaps more likely caregiver starts noticing. Now, what are those other causes? Those can be anything from depression, stress, anxiety, any blood flow issue to the brain. It can be infection, could be hormonal issues like thyroid problems, vitamin deficiency, you haven't had good sleep the night before, alcohol use, prescription side effects. So all of those other causes that could be contributing to somebody's memory loss, we really need accurate ways to diagnose what is causing a patient's memory loss and whether a patient really has memory loss due to Alzheimer's disease or not.
Thank you for explaining that. And
Yeah.
another term I've heard a lot is sundowning. Is that something you could briefly explain for our audience?
Sure. So brief explanation. I believe that's a late day confusion. So if someone you care has dementia, their confusion and agitation may get worse in the late afternoon and evening. So what they suggest, to my knowledge, and perhaps a clinician is better to talk about this than I may be, but it's very important to stick to a schedule when it comes to dementia patients.
Thank you. Thank you. Well, I think that we're going to conclude today our conversation. Thank you so much for being my first guest and first speaker. I really appreciate it, and I've really enjoyed this time getting to know you. As I mentioned, my goal is to encourage women to enter STEM careers or look into science, science as a field. So with that, I'd like to ask you for your favorite book recommendation or something that you would like to share with the audience that encouraged you in STEM.
Always ask a nerd to share their favorite book, right? Yes, actually, since we're talking about Alzheimer's disease today, I would say one of the recent books, which I probably have at my desk. Let's see. Here it is. It's called The Problem of Alzheimer's Disease. I don't know if you can see the whole page or the whole cover or not.
Yeah.
It's by Dr. Jason Karlovich. It is a very engaging book about how this rare disease of Alzheimer's disease turned into crisis and what we can still do about it. Very informative book. I highly recommend it. One of my other favorites is a book called The Inner Engineering. It's a book about how you can stay in joy. And as we know, that's good, healthy for the brain. So I would really highly recommend that book as well.
Oh, thank you. Thank you very much. And I will link those book recommendations in the comments after our conversation.
Sounds good.
Thank you. Thank you very much.
Thank you, Taya. Take care. Bye.
Bye.